Speak sponsored by RxCardClub.com. Get a free prescription drug card and save up to 85% on prescription drugs. RxCardClub.com. Point 4 things that may happen when you eat too much cantaloupe. Break key takeaways. Cantaloupes are sweet melons that are safe for most people to consume. Cantaloupes are unsafe for people with a history of allergic reactions to this melon.Cantaloupe's rough skin can cause contamination. To lower your risk of foodborne illness, rinse the melon thoroughly and wash it with a clean scrub brush. The fruit is rich in potassium and may increase the risk of hyperkalemia in people taking beta blockers for heart disease. Break cantaloupe is a sweet, juicy, nutrient-packed melon that's generally safe and healthy to enjoy. However, it can sometimes carry potential risks like contamination or allergies. Break 1. Allergic reaction. Break cantaloupe is safe for most people, and allergies are rare. However, eating cantaloupe can trigger an allergic reaction in people with certain food allergies. A food-related allergic reaction usually occurs within 2 hours of exposure. Break research shows that people allergic to grass may be more likely to have a cantaloupe allergy and allergies to watermelon, honeydew melon, oranges, peaches, tomatoes, and celery. Break symptoms of a food allergy may include break vomiting, diarrhea, hives, cough, wheezing, shortness of breath, facial swelling, trouble swallowing, anaphylaxis. Break if you have ever experienced any symptoms of an allergic reaction after eating cantaloupe. Avoid this fruit until talking with your allergist or healthcare provider. Break 2. Food poisoning. Break cantaloupes have rough, textured skin, making them more likely to carry bacteria that cause foodborne illness, including Salmonella. Break symptoms of Salmonella poisoning usually last for 4 to 7 days and may include break watery, diarrhea, severe stomach cramps, vomiting, headache. Break to lower your risk of foodborne illness, keep these tips in mind. Break clean your cantaloupe before eating it. Use a clean scrub brush to wash the skin before slicing a cantaloupe. Always use a clean knife and cutting board when preparing it. Discard it once the sliced cantaloupe has been sitting at room temperature for 2 hours. 3. Too much sugar. Break cantaloupe, like all fruits, contains natural sugars. To avoid too much sugar in their diets, people with type 2 diabetes or those following a low-sugar diet less than speak greater than T may need to limit their intake of cantaloupe. Break experts recommend that people with diabetes include fruit in their regular diets. Talk with your healthcare provider to determine if you should limit your cantaloupe intake due to its sugar content. Break 4. High potassium. Break potassium is a mineral that acts as an electrolyte in the body. Cantaloupes are rich in potassium, with one serving providing about 10% of a person's daily needs. Potassium affects how the heart functions. People taking certain heart medications, including beta blockers, may have higher potassium levels. Break consuming large amounts of potassium-rich foods while taking beta blockers may cause high potassium levels, hyperkalemia, and kidney damage. Talk with a healthcare provider if you are currently taking beta blockers or other medications that affect potassium levels. Break who should avoid it? Break most people can safely add cantaloupe to their eating plans. However, some people may be at a higher risk of Salmonella poisoning, which includes break people who are immunocompromised, weak immune system, children ages 5 or younger, or infants younger than 1, who are not breastfed, those who take stomach acid reducers and other medications, people ages 65 and older. How to safely enjoy cantaloupe. Break cantaloupe is a sweet, tasty fruit that most people can enjoy safely. To lower your risk of foodborne illness, take the following precautions. Break wash your hands thoroughly. Then wash the cantaloupe's skin using a clean scrub brush. Dry the melon with a clean paper towel. Eat the cantaloupe as soon as you slice it. Consider cutting the skin or rind off before serving. Cut cantaloupes should be stored in a covered dish in the refrigerator. Any leftover fruit sitting at room temperature for over 2 hours should be discarded. RxCardClub.com. Get a free prescription drug card and save up to 80% on prescription drugs. Less than /speak.